Welcome to Doctors on Call. I'm Jenna Miller. You've made an appointment with a doctor. You might be sitting in the waiting room or clinic and you hear the doctor will see you now, or the nurse, or the physician assistant. There has been a shortage of physicians to treat the country's medical needs, and the nurse practitioner and physician's assistant have filled the gap as your medical provider. Patients might prefer to see a PA or NP rather than waiting to see a physician. While doctors will always be a vital part of healthcare, physician assistant is one of the fastest growing occupations in the country. Physicians, assistants, and nurse practitioners in healthcare. That's our topic today on Doctors on Call with our guests, Teal Sander, PAC, and Dr. Tyrel Somers from Russell Regional Hospital.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Tyrel Somers received his medical degree from the University of Kansas School of Medicine in Kansas City, Kansas. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Somers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Somers has been affiliated with Russell Regional Hospital since 2015. Teal Sander received her medical degree and Master's of Physician's Assistant from Wichita State University in 2016. She is board certified with the National Commission on Certification of Physicians Assistants and is a member of the Kansas Academy of Physicians Assistants and the American Academy of Physicians Assistants. Teal has been with Russell Regional Hospital Physicians Clinic since September of 2016 and is currently serving the Kansas Academy of Physicians Assistants as a director at large. Our phone lines are open at 1-800-337-4788 toll free if you have any questions regarding physicians assistants and nurse practitioners on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician. Thank you so much for joining us, both of you. Let's first start with asking to explain the history of PAs and how that field was started.
Okay. Well, the history of physician assistants started about in the late 60s. Dr. Eugene Stead from Duke Medical University recognized the lack of physicians in the rural communities. And he started the Duke University Physician Assistant Program with, I think, 3 Navy corpsmen who had extensive medical training in their naval careers, and then they were kind of fast-tracked through physician-based education that was used in World War II, and then from there kind of took off. So we've gained recognition and basically treat patients in all areas of medicine and practice medicine alongside our physician counterparts.
Okay, so Dr. Somers, explain what your role is as far as working with the physician's assistants.
So one of the biggest things that we help with the physician assistant is the day-to-day kind of assistance with management of patients. A lot of the times, like Teal and I will see the same patient population and we'll kind of treat the same diseases and the same conditions. The biggest thing is that with my advanced medical training, I have a little bit more knowledge and experience than Teal might have in certain conditions, and so she'll come and consult me every now and then in regards to what should be done about a patient's management. But for the most part, Teal and I can kind of see the same patients and do pretty much the same thing to help them.
Now, can a physician assistant prescribe and diagnose illness?
Absolutely. Mm-hmm. We diagnose, treat diseases and illnesses, prescribe all sorts of medications, basically have almost full autonomy there to treat and diagnose patients.
Okay, what is the role of a PA in healthcare?
PAs serve in all areas of medicine, from family practice to all the different specialties. We, like I said, see patients, diagnose them, order tests, prescribe medicines, and see the whole gamut of medicine and healthcare.
Now, is there sometimes that a patient might see both of you in the office?
Oh yeah, definitely. There's been times that like a patient will start seeing Teal to begin their patient care, but then she'll identify that maybe there's something that I need to coordinate with and need to see the patient specifically for. And so I'll come in during the visit, kind of evaluate as well, and then we'll discuss a plan together and decide what's best for the patient.
And now, can the patient request to set up an appointment directly with the PA?
Oh, absolutely. And we love that. So we often have a lot more availability than the physicians, and so it's often a lot easier to get into a PA or a nurse practitioner much sooner. And we're kind of an extra set of eyes and ears for our supervising physicians, so you're almost getting a 2-for-1 deal. So
Excellent. Okay, we're going to go to the phone lines now. We've got a caller from Hayes that's waiting to ask a question. Go ahead with your question for Dr. Somers and Teal Sander tonight.
Hi, doctors. This is Christina, and my family and I all got the flu shot this year, but we all still got terribly sick. And I'm kind of like, what is up with that? So could you explain that to me? I'm curious if I should still go ahead and get the flu shot for my family and I next year if it's not effective.
Well, thank you so much for your question, and that's a great question to ask. So the influenza vaccine is a wonderful vaccine that helps prevent the spread of influenza. One of the things that's very, very tough about it is we have to kind of guess for the upcoming flu season exactly what's going to happen and what specific strains of influenza we might see. That's very challenging at times. That means that sometimes our coverage is very, very good, and sometimes our coverage is not so good. And so what we have to often do with patients is we have to kind of figure out if that influenza vaccine is going to work or not, and unfortunately sometimes it's just not quite there. Now, it is extremely important though to get the influenza vaccine, because even when you do get that vaccine, it reduces the severity of your influenza and then also the duration of the influenza that you would have. So I would always encourage a patient to receive an influenza vaccine even in a year in which we don't get perfect coverage like this year. It's important to do.
Okay, well, while we're on the topic of influenza, I'd be interested in knowing, it seems like influenza A was the one that was really big this year. Can you describe the different A, B, all the different strains, if you will?
Yeah, so there's different strains of influenza. They're primarily grouped into a classification of Group A and Group B. Group A is primarily seen with like an upper respiratory type infection. So it'll begin kind of with like high fevers, muscle aches, joint aches, and then kind of a little bit of a cough. Group B is typically a gastrointestinal based one, though it can have some upper respiratory complications as well. So you might have nausea, you might have an upset stomach, you might have some vomiting, unfortunately, but both definitely do cause high fevers, joint aches, and muscle aches, which are kind of the hallmark of any influenza-like infection.
Okay, so for next year, well, of course, we're probably still getting through it's maybe dwindled down in our county, but I don't know the rest of the state what's looking like. But what other precautions can a person take as far as not picking that up?
Oh, definitely. One of the best things you could do is proper hand hygiene, washing your hands before you eat, after coughing, sneezing, blowing your nose, using hand sanitizer frequently, and just basically getting enough rest and fluid intake during the cold and flu season, and just generally keeping your body nice and healthy as best as you can. So.
Excellent. Okay, so let's talk about the difference between the education and training compared to between the PA and the MD.
Good deal.
I'll start with what you do for a medical doctor. So for a medical doctor, we have a 4-year undergraduate degree, and then we're accepted into medical school. Medical schools range anywhere between about 3 years to 5 years. Mine specifically was 4 years. And then after that, we have a post-medical school residency training. And that normally includes 1 intern year and then a set number of years afterwards, depending upon a specialty. They can range anywhere between 2 years all the way up to 7 years, depending upon the specialty. I went through 3 years of residency training with the internship total. And so in total, I had 7 years of medical training and then 4 years of undergraduate training as well. So that's kind of the length of time it took for me to become a medical doctor.
And for physician assistants, most of them are a master's degree level. They all require a bachelor's degree and a series of prerequisites, and then the PA programs are usually about 2 years total length. In that year, we do a year of didactic or the classroom work, and then a year of clinical work, working very closely with physicians and getting all of our clinical training. And so it's a lot shorter, a lot more condensed, and it's very fast-paced. But I think the offhand estimate is that we learn about 70% of medical school in half the time. So,
Excellent. Let's talk about the difference between a PA and a nurse practitioner.
okay. Yeah, nurse practitioners go through nursing school and then through a nurse practitioner program. They all have nursing backgrounds, and they follow the nursing model of medicine and are registered and certified through different nursing boards and nurse accreditations. Physician assistants, we come from all sorts of backgrounds. I came from a radiology background, and we have nurses who go to PA school. We have people who have no background in medicine who bring a lot of their experiences to the PA programs, but they all have to have the basic prerequisites and meet the general educational guidelines for that.
Now, can a nurse practitioner diagnose or treat a patient?
Yes.
Yeah, absolutely.
Okay, excellent. So, what's the difference between, you hear the nurse practitioner and a registered nurse? What's the difference between those?
Okay. A registered nurse is, well, how to best describe this? Basically, probably the other way would be a nurse practitioner has additional education and training and is certified in order to, certified and licensed in order to diagnose and treat patients and prescribe medicines. That'd probably be the biggest.
Yeah, well, a registered nurse still has to be accredited by the Board of Nursing, still has to take special kind of training courses and an exam to meet certification requirements. But yeah, a nurse practitioner would have additional training that would be present.
And how important is to be board certified?
It kind of assures an additional degree of education and testing, and I'm losing the word here, but just kind of confirms that they've met the standards to become certified and have been rigorously tested on that.
Okay, now can a NP or a PA specialize in certain health areas?
There are certain specialties, let's see, specifically like with nurse practitioners, they usually have a different track with their program, like may follow strict family based education or emergency or just women's health. Physician assistants is a general broad certification. Right now they have a couple of additional specialty certificates that are kind of gaining track, but that's one of the biggest benefits of the physician assistant is we are very we have a great general knowledge and can fill in gaps where we are needed. So you see us in family practice and you see us in specialties, and my degree will allow me to work in family practice, and I could go do surgery or be a surgical specialist, PA, or women's health. It's very mobile.
Okay, let's talk about both the doctors and the PAs, their continued education, if you will. What you have to do to keep up. Once it's not just you go to school and you're done. Let's talk about that. So.
Yeah, absolutely. Yeah, continuing medical education is a huge part for both PAs and for doctors and also for NPs. It's part of the reason why you kind of want to stay ahead in the medical field. You want doctors that have the knowledge that's required to treat conditions, especially as they change. Medicine itself has kind of changed as time's progressed. It's kind of refocused, and we are constantly producing new guidelines for treatment. Continuing medical education is done pretty much continually. That's why it's called. We take classes, we read journals, we kind of educate each other, we talk about treatment plans, we talk about guidelines as they come out so that we are giving our patients the most current and up-to-date care. We go to specialty conferences if we have specific topics that we feel deficient in. And then finally, a lot of boards require us to take certification examinations that are done frequently to kind of prove our knowledge so that we can reassure both our colleagues as well as our patients that we're highly trained and highly qualified.
And how often are you required to continue your education, if you will?
Currently, we have to have a certain number of continuing education credits every 2 years. I think ours is 100 every 2 years, and
ours is 150 every 3.
and then we have a recertification exam that's currently in place that has to be completed every 10 years.
So what happens if a PA or a doctor or a nurse practitioner choose not to continue their education? What happens then?
And so one of the things that can happen is if you don't meet certification criteria, you will no longer be board certified, meaning that you will no longer get that recognition from the board that is sponsoring you. Another thing that can happen is that you can be not really disqualified from serving as a family practitioner, but you'll kind of be labeled as a general practitioner rather than like a family medicine provider or other type of specialty that physician is in. That's not necessarily a bad thing, but it definitely means that doctor may not be as current in their knowledge as, say, someone who is board certified.
But they can continue
Yes.
practicing.
Absolutely.
Okay, excellent. We want to remind you that we're talking with Dr. Tyrel Somers and Teal Sander from Russell Regional Hospital Physicians Clinic. We are talking about nurse practitioners and physician's assistants. If you want to give us a call, our number is toll-free, 1-800-337-4788, or if you have a general health question, they'd be happy to answer that as well. Let's talk about the state of Kansas. They allow advanced registered nurse practitioners to operate independently of physicians.
Currently, I believe not. They had some legislative changes put in that did not make it through committee, I believe, but I can't speak more to that. So I don't believe so.
Yeah, and I'm not sure, I can't speak on that directly either. I can say that having a physician kind of sponsor and someone that's there to run by specific cases is extremely important, whether it be a nurse practitioner or a physician's assistant. Not necessarily that they don't have the knowledge or the foresight to diagnose or treat illness, but just always knowing that there's someone who has different experience, a different set of skills is extremely important in practice.
So we talked a little bit about the relationship between the MD and the physician's assistants. Let's talk about the relationship between the MD and the nurse practitioner.
Sure. Nurse practitioners are wonderful at mid-levels that allow us to kind of see more patients and provide a little bit broader scope of care. A nurse practitioner is trained very much like a physician's assistant, where if they have concerns, they have questions about a specific patient or a specific case, they can come to their providing physician and kind of discuss what options are available, what treatments are there, and then provide care to the patient. It's not uncommon that a nurse practitioner will also ask a physician in regards to a treatment course, and then we'll sometimes have a physician check on you as well.
Okay, so then can we discuss, is it similar between the PA and the nurse practitioner?
Yeah.
As far as the relationship, I guess.
Yes, between the PA between the nurse practitioner. Okay,
Yes.
yeah, we work in collaboration with our nurse practitioner friends a lot. So the whole point is to extend access of healthcare to our patients. So, and that's especially very important here in our rural areas. So.
Yeah, let's talk about that, how important the nurse practitioner and physician's assistants is in our rural areas. Let's talk.
Absolutely. With the physician shortage, especially in our rural areas, it's just hard to entice somebody to come out to a rural area, especially if you have no connections out here. And so having nurse practitioners and physician assistants who are usually, like, I came from Western Kansas. I live here and I'm very happy to be serving patients out here in Western Kansas. And it's just a very great way to extend healthcare services to patients in our rural areas where we just aren't able to keep as many physicians out here, but we're able to see and diagnose and treat and really get them the healthcare that they need to be healthy.
Do you find any patients being reluctant when they find out you don't have doctor in front of your name?
Oh yes, absolutely. But oftentimes they get to know us and they like the care that we receive, and we often have a little bit more time to spend with the patient, and the patient really appreciates that. And several studies have looked at the care provided by nurse practitioners and physician assistants compared to medical doctors, and find that we provide a very similar level of care, and often with a little bit higher satisfaction scores.
Excellent. Okay, we're going to head to the phone lines now. We've got a caller from Liberal waiting to ask a question. Go ahead with your question for doctors and PA tonight.
Yes, am I on there?
Yes, you are on the air.
Yes, ma'am. I have a degree in agriculture with Bachelor of Science, and I have several other minors in accounting and things like this. and I have degrees, in front of me or in front of the patient or whoever my client is, showing that I have the degree, how many years I took classes of, like you're saying, you need to take so many classes per year to keep up with your degree certification or your medical certification. Why is it that in some most offices or a lot of offices that I've tried to make a decision with, say, for example, 3 surgeons, how can I make a decision if I don't see these degrees or the things that are board certified? These individuals, how can I make my mind if I don't show me or if I don't know what to do to make that decision based on experience, medical degree, where they went to school, that they've board certified, things like this. There's what I need to do.
Okay. So I think you're asking if they're not putting forth their degrees and certification and all of their accolades out in front of you, how do you make that decision? And basically, it's almost a trial and error. You go to somebody who maybe your physician or your PA or nurse practitioner has recommended. You could look up reviews online, ask friends, family members, and get to you will always usually have a consultation with that provider and see how you feel with them, and if you like how they treated you, and if you feel confident in their ability to care for you.
Excellent information. Okay, we've got a caller that doesn't want to be on the air, but they have a question. It's a 2-part question. I got the first part, so they're going to have to tell me what the second part is. But first, they're wondering if you charge the same, if it's the same charge between a PA and a doctor. So we'll start with that, and then they'll have to tell me what the second part of the question was.
I don't know if the charging, but I know the billing.
So yeah, so medical billing and medical charging is an extremely difficult thing to describe and kind of explain. So charges are set very much the same way between a physician and a PA, and same as a nurse practitioner. We all charge the same amount. It's the reimbursement that comes from the insurance side point that changes. Obviously, because a physician has a little bit more skill than a PA or an NP, sometimes some insurance is reimbursed differently to providers depending upon their experience. For example, me being just a family physician, I actually have a little bit less experience than, say, like a neurosurgeon in regards to how they evaluate a patient. So the reimbursement that I ask for a specific charge may not be the exact same for me as it would be for like a neurosurgeon. The same thing goes with like a physician's assistant or a nurse practitioner. Though we charge the same levels of care, the reimbursement might be different, and that's all set up by insurance companies. It's not set up by our billing department or anybody with the facility.
Okay, interesting. Okay, the second part of the question was they wanted to know if they let you know, if you've just set up an appointment with the doctor, if they let you know before they take you back, like you're going to see the physician's assistant or you're going to see the doctor.
Yeah, usually I can't think of too many instances where you want it. I guess one is like we have a walk-in clinic, and sometimes it may get very, very busy, and we often jump in and help to be able to see the patients faster so nobody's waiting out in the waiting room for too long. And so you might think that you will be seeing myself, and then Dr. Somers might jump in there and see you. So otherwise, when you make the appointment, you should always be seeing who you've made that appointment with.
Okay, so kind of going along with the caller that asked about how do they know? Like, what's a good way to, I mean, I know you can Google anything anymore, but to find out what the right, either family physician or PA, who's right for you, I guess. Let's talk about that.
So the first thing that I would say is that one of the most important things is to ask. Talk with people that you know, talk with people that you trust, and see if there are certain providers that they have seen that they trust and that they feel comfortable with. That's probably one of the biggest things. The second thing I would encourage people to do is if you're interested in meeting a provider, whether that be a PA, a nurse practitioner, or a doctor, make an appointment with them. Come in and talk with them. Ask them about the style of care that they provide. Be very direct and blunt in what you're looking for in a doctor or a mid-level provider, and see if they're able to meet those expectations and provide that care for you.
What about you, Teal?
Yeah, it's always great to just be able to meet the patients, and I think a lot of our kind of referrals come from word of mouth, and so if you've had a good experience, and that's where a lot of our patients get that, is from referrals from their family and friends. So.
And should a patient feel bad, I guess, if you will, if they maybe meet with a doctor or PA and don't really connect? What should they do at that point?
No, not at all. No, there's very many times that we'll meet patients that personality-wise we just don't connect with, and that's okay. There's nothing wrong with that. We're all different, unique individuals, and we all have different strengths and weaknesses that kind of attract us to certain individuals. So if you meet a doctor or PA and you're just not clicking, you're not meshing, don't feel obligated to stay with them. Very much you can make an appointment with someone else in their office. You can make an appointment with someone else that's in another facility. There's nothing wrong with that. One of the most important things that will allow you to share information with your provider is feeling comfortable with them. And so we never want people to feel like they are forced to see a specific physician or provider just because they're there. There's very many people that could see you and take care of you.
Okay, great. Thank you guys so much for joining us tonight. That's Dr. Tyrel Somers and Teal Sander from Russell Regional Hospital's Physicians Clinic. On our next Doctors on Call, we'll learn about healthy eating and exercise. You can email questions for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Gove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital. Experts, neighbors, friends.